Well, we've heard already a lot about the smartphone, and sure, the smartphone has been a very successful tool. Now, it hasn't been successful because of the technology. It has been successful because of the communication. And without communication, if you do not get feedback, if there's no information that is being exchanged, even the fanciest of all our smartphones becomes a useless device. Now, today in medicine, the smartphone is hardly being used to exchange information because there is no information that is currently being exchanged between the patient, the smartphone, and the physician. Now, that's going to change. First of all, iPhones are everywhere, or smartphones are everywhere. Infrastructure is there, and computing power is increasing. Now, in order to make the smartphone a really clinical device, we have to exchange information that will be relevant for the patient and provides him with information that will improve his care. Now, in order to set up this information exchange, we can do that in a two-tier system. First of all, the smartphone has to be turned into some type of a self-monitoring device where the patient can actually look at his own data, measure his own blood pressure, measure his own glucose levels, and his smartphone will give him information how to possibly adjust some of the medications that he needs to take. In addition, the smartphone can coach him through exercise programs or through a weight loss program. But far more importantly is the fact that we need to exchange this information. We have to get that information available to caregivers. Imagine a specialized nurse, your family physician, or a specialist who will get this information. They can look at it, they can watch over your shoulder, and they can intervene whenever something is going wrong. This type of feedback to the patient will make this clinically relevant. Now, as of today, your smartphone has already some sensors available that could be or could collect clinically useful information. It has a camera, it has a flashlight, it has a microphone. Now, the microphone could collect information on your heart sounds, or it could register your snoring at night, possibly suggesting you have a sleeping disorder. It also has a flashlight and a camera, and you can put your finger on the camera and the flashlight, and it'll take a few seconds before it is detecting my pulse, but then all of a sudden it will start registering my heart rate. That heart rate is important because it does tell me whether my heart rate is within normal range and my heart rate is fast. Why? Because I'm not exercising, but I'm giving a TED Talk. And giving that TED Talk is important information to actually interpret that result. It can be lower, it can be higher. Now, giving that information, that could be very clinically relevant. Now, let's suppose that someone in the audience were to faint, were not feeling well. I have a camera, and I could measure with the camera. I could look at someone, and I could look at someone's face. And based on technology built in the camera, it will register slight differences in color, and it will also register a heart rate. So can you imagine what type of information that is available at the tip of your fingers just while you're having your smartphone at hand? Next to built-in features, built-in sensors that you have right at hand, there are on the market already a wide variety of sensors that you can hook up onto your iPhone. This is one sensor that you can measure temperature with. There's sensors to measure blood glucose, and there are all a variety of sensors. Now this one is the one and only FDA-approved sensor to measure your electrocardiogram. It is like a case that you can hook up on your iPhone. It is equipped with 2 sensors in the back, and you can hold it firmly, and then your electrocardiogram is available. Now, this is information that in the past was only available in your doctor's office or in the hospital. Now you can read you really have your electrocardiogram at your fingertips. Now, it doesn't tell me only what my heart rate is, and it is still rather fast, but it tells me in addition whether it is regular or irregular. In addition to the heart rate, an electrocardiogram can also give me important information on whether I'm suffering a heart attack. And there has been a case report where this type of information diagnosed a passenger on an airplane having a myocardial infarction. So this type of information is now available everywhere. Sensors don't have to be hooked up. Sensors can be in your environment, and they can communicate with your cell phone. Short-range communication using Bluetooth, high-frequency ultrasound. It could be your weight scale. It could be a blood pressure measurement. But it could also be patches, stick-on patches that you are wearing with built-in sensors. I'm actually wearing a patch, and it does have a built-in sensor that's measuring my electrocardiogram. That electrocardiogram is being streamed. Now, and again, now I need to go to my help desk, I think. Oh, here it is. Okay. So now I'm wearing a sensor that is streaming my electrocardiogram through my smartphone, and I can stream it anywhere. Now, the advantage of a system like this is that it does it in the background, as the previous speaker said. To measure an electrocardiogram or whatever, I don't need to do any action, and it's not a snapshot in time. If battery life or cost of communication was not the limiting factor, I could monitor myself for 24 hours, 7 days a week, using this type of system. Now, patches can be equipped with multiple sensors. This one has an electrocardiogram, but it can be equipped with a device that registers my respiration rate, my breathing pattern, whether I have fluid buildup in my lungs, and might be the first sign of a episode of heart failure. So these patches, or these sensors, can be multisensorial. They can acquire lots of information. They can also be built into my clothes. Imagine that you're going to go for a workout, and you're wearing your sport clothes, and it's measuring your vital signs. This type of sensors could be built into the seat of your car, measuring your vital signs while driving your car. As of today, there are already more sophisticated sensors that can be implanted into the heart, and they will measure my blood pressure, pressures in the heart, electrical activity, or even hormone levels that may warn my physician that I'm going to have an episode of heart failure. Multiple sensors will be necessary to evaluate, to follow up, to monitor patients with complex diseases and multiple comorbidities. Now, how are you going to solve this problem? So what do we need to do? Well, first of all, the sensors need to be sophisticated, reliable, and clinically validated. I have to be sure that what I'm measuring, that is real, that I can base clinical decisions on the numbers or the data that we collect. Algorithms have to be built to interpret all this information that is being collected. And the previous speaker has said, we are going to be monitored all the time. Your device will know whether you're asleep, driving your car, walking around. Algorithms will have to analyze the data and select the most interesting things so that only the clinically relevant information can be presented to the physicians. And again, we need doctors. We need physicians who will interpret. The doctors of today are what we call the digital immigrants. They still largely live in the landline era. However, the doctors of the future, and some of them are sitting in the audience, they are the digital natives. They grew up with smartphones, tablet PCs, and the internet. They embrace new technologies, both in their professional and in their personal lives. So the buildup of a clinical call center with specialized nurses and interested physicians is absolutely necessary to look at these data, to interpret them, and to give valuable feedback to the patients. So smartphones of the future, equipped with multiple sensors, together with a smart algorithm and a feedback system to the patient, will dramatically change the way we organize healthcare in the future. And by the way, you'll still be able to make a phone call with it.